So good afternoon, everyone, and thank you for being here on our COVID-19 briefing here. I'm joined by members of our whole government COVID response team with our interim director, Dr. McDonald, along with Mark Pappas, our senior advisor on the COVID, Commerce Secretary Pryor, Education Commissioner Fonte Green, along with us on special assignment here. We are Ernie Amonte from the Chief of Staff and Lieutenant Governor's Office, who's working at Department of Health right now, and of course Anna Nabais, who is our Assistant Secretary of Health and Human Services. So shout out to each and every one of you for your help and your work that's going on to bring us this point today to make certain announcements. I want to begin with an update on Rhode Island's current COVID data. We are seeing a lot of encouraging movement in our numbers, which has guided the updates that we'll share today. Since Rhode Island experienced its last spike in cases in early January, cases are down by nearly 94%. On a 7-day case average is declining. Our case averaging is declining as well. It's down 71% from 2 weeks ago. Our 7-day average for percent positivity is down from 12.2% last week to 8.4% this week, and today we're at about 4.3%. To add some context, we currently have the 8th lowest percent positivity rate in the country right now. And there are only 7 states with a lower percentage than Rhode Island, and we continue to move in the right direction on this ranking. Our hospitalizations have also dropped below 300, down to 227 in the last 7 days. Overall, since peaking at 598 reported hospitalizations in mid-January, Rhode Island's hospitalizations have decreased by about 52%. We've made considerable progress against COVID-19 and the recent surge, and we are in a much better place than we were in early January. This is a result of Rhode Islanders stepping up to do the right thing in terms of their vaccinations, in terms of their testing, which we continue to lead the country in testing. And of course, we discover more variants, more viruses, the more you test. And that's why I bring up the point that right now we're the 8th lowest infected state in the country. And during this time frame over the last 6 to 8 weeks, we've held those spots right in that area. But we have tested more. And we thank the people in the state of Rhode Island for stepping up and doing what we need to do to keep us safe. We also know that as a state and a country, we have to learn how to manage COVID as we move from a pandemic to an endemic stage of the virus. It's all about having flexibility to adapt and emphasizing personal responsibility. As a result of that, and after looking closely at our data trends with the Department of Health, we have some updates to share today. We are lifting Rhode Island's statewide mask or proof of vaccination protocol for indoor public settings beginning Friday, February 11th. With our numbers continue to drop and having the second highest vaccination rate in the country, we can safely make this shift, which will also put us in line with other New England states. In addition, if the General Assembly does extend my emergency executive authority for 45 days, as currently proposed, I would extend the executive order requiring masking in schools until March 4th. After that time, school masking policies will be decided by individual school districts, not the state. With this state-driven change, Rhode Island will be aligning with other nearby states like Connecticut, Massachusetts, New Jersey, and Delaware when it comes to masks in schools. This is an important point on timing. Over the next several weeks before this change takes effect, we expect that numbers will continue to decline, putting us in a strong position to transition to local decision-making on school masks. We want to give districts plenty of time to plan, and we want to give parents an additional opportunity to have discussions at the local level and get their kids, and also get their kids vaccinated during this time frame. We can't stress enough how crucial this is to our long-term response to COVID and the efforts to keep our kids in school. Get vaccinated, get boosted. We will also use this time for the Department of Health to share clear public health guidance that local districts can use to guide their decision-making. This will take into consideration things like positivity rates, vaccination rates, and other metrics. I also want Rhode Islanders to know that none of these decisions were made in a vacuum. Our team at the Department of Health, the Department of Education, and Commerce have been in close contact, meeting with stakeholders like the Superintendents Associations, the School Committee Association, our union leadership, the League of Charters. We've been speaking with other governors, and most importantly, looking closely at the data. Our team feels we can safely and confidently take this next step based on decreasing COVID numbers and increasing vaccination rates. We want to be clear. If you are unvaccinated, we strongly recommend you continue wearing masks indoors. Individuals who are unvaccinated continue to be hospitalized at a rate that is more than 3 times higher than the hospitalization rate for people who are vaccinated. And our best advice to everyone right now is this: if you haven't got vaccinated, please get vaccinated. If you are in line for a booster shot, please get a booster shot. We will be doubling down our efforts, as we did in the early stages of the vaccination, on boosters, and we'll be working with the Department of Health to really make that a front center priority for us. This is what will keep our economy open and our kids safely in school. Over the next few weeks, we'll be doubling down, as I said, on the boosters to make sure all eligible Rhode Islanders are up to date with their COVID vaccines and fully vaccinated. So again, I want to thank the people of the state of Rhode Island for really stepping up during the last several weeks, which has been a challenge on our health care, it's been a challenge on our schools, it's been a challenge on our economy, and clearly been a challenge for our Department of Health to manage through, and they have done that in a real strong way. So thank you to the people in the state of Rhode Island, and thank you to the parents that are voicing their opinions. All opinions are important, but in the end, we have to do what we believe is the most important thing right now is in terms of the health priority of the people who live in the state of Rhode Island.